Hello everyone, this is Dr. Alex Vasquez with today's Fast as Possible Research Review. And today we're going to talk about an article that was published in the journal Pediatrics in 1998 by the American Academy of Pediatrics. I'll provide you some clinical context as well as social context and some practical action. This is going to be a spontaneous office-recorded video that will also be available through my various websites and social media channels. Title of today's article is Acute Encephalopathy Followed by Permanent Brain Injury or Death Associated with Further Attenuated Measles Vaccines, again published in the journal Pediatrics 1998, and you can see the rest of the citation there. Here I will provide you with their summary and conclusions. A total of 48 children ages 10 to 49 months met the inclusion criteria after receiving measles vaccine alone or in combination. 8 children died, and the remainder had mental regression and retardation, chronic seizures, motor and sensory deficits such as blindness and deafness, and also movement disorders. The onset of neurologic signs or symptoms occurred with a non-random, statistically significant distribution of cases on days 8 and 9. No cases were identified after the administration of monovalent mumps or rubella vaccine. Conclusions. This clustering suggests that a causal relationship between measles vaccine and encephalopathy may exist as a rare complication of measles immunization. Statements from my perspective, this is kind of a preemptive summary. An intelligent and attentive reader cannot avoid noticing the intellectual contamination and propaganda contained within this article. For example, if you just look at the last sentence of their conclusions, this clustering suggests, so they've already started to weaken their findings by putting in the word suggests. This clustering suggests that a causal relationship between measles vaccine and encephalopathy may exist. So we're suggesting that it may exist, and then let's qualify it again by stating it's a rare complication of measles vaccination. That's pretty pathetic, and I'll explain why it's even more pathetic than this as we go through my review. So causality can be determined. MMR vaccination can cause death, mental regression and retardation. Of course, they didn't want to say autism. Chronic seizures, motor sensory deficits such as deafness and blindness, and also movement disorders. They should have also stated here behavioral disorders such as aggressive behavior and attention deficit, which they do mention in the article. Point number 2 is that the true percentage or frequency of this problem cannot be determined because of the absence of accurate studies and also non-existent post-marketing surveillance.
According to a 2005 survey reported by the US CDC, 37% of healthcare providers have acknowledged witnessing a recognized adverse vaccine event such as brain damage, mental regression or retardation, or catastrophic seizures, but only 17% have made a report to the US Vaccine Adverse Event Reporting System. Amazingly, 55% of healthcare providers have remained silent. Repeat, 55% of healthcare providers have remained silent even after witnessing one or more adverse vaccine reactions. Obviously, adverse vaccine reactions are underreported, and no sufficient system for post-marketing surveillance exists in the United States.
Point number 3, again from my perspective, this is medical filtration of information, and I'll show you that when we look at the article itself. This is a gross underestimation of the problem. Also, it included unjustified limitation of considered cases. They limited their consideration to within 15 days of the offending vaccination, and they provide no biological basis for that, and indeed, no biological or clinical or medical basis for that exclusion exists. So they are intentionally narrowing the range or narrowing the field of consideration in order to support the conclusion that they wanted to arrive at, which is to say that this is rare. Point number 6 that I will make here is that they misrepresented the compensation platform in the United States, which barely functions at all. Point number 7 is that the conclusions of this article are remarkable for their emotional sterility, and also their conclusion is socially inappropriate. So here you can see the original article, Acute Encephalopathy Followed by Permanent Brain Injury or Death Associated with Further Attenuated Measles Vaccines, a review of claims submitted to the National Vaccine Injury Compensation Program. Of course, this is in the United States, and again, you can see this is published in the journal Pediatrics, 1998, published by the American Academy of Pediatrics. I've already read to you their conclusion. They do state that causality can be determined, But again, the true percentage or frequency of this problem cannot be determined because of failure of accurate studies and the non-existence of effective and mandatory post-marketing surveillance systems. They do make a comment here, which you can see that I've noted here just with my own personal notes. They state that post-infectious encephalopathy complicates approximately 1 per 1,000 cases of natural measles. That strikes me as being a really high number, believe it or not. So what they're stating again is that post-infectious encephalopathy, or inflammation and dysfunction of the brain, occurs in 1 per 1,000 cases of natural measles. That occurs to me as high, and so I looked up the background information for that claim, and I found this document at the website for the CDC, that is the Centers for Disease Commercialization. And what they stated here is that in 1963, before vaccine development, per, let's say, 3.5 million cases of measles, they found 1,000 cases with encephalitis. So that's one case of encephalitis per 3,500 cases of measles. Now, in the vaccine era, the disease suddenly became more severe, and they state that now we have 1 per 1,000 cases. So a very reasonable question is, beyond the simple accuracy of this information, because of course the numbers could be fudged, as they often are, in various pro-vaccine articles written by pro-vaccine organizations. But the real question that I have here is that the possibility exists that by administering this vaccine, they've changed the clinical expression of measles from being a relatively benign condition to one that is more encephalopathically aggressive, we might say. So perhaps the disease was more benign before the vaccine was introduced to the population. So again, originally one case of measles encephalitis per 3,500 cases of measles, and now they state it's 1 per 1,000. So I was curious about how that changed so much. We'll look at those vaccine ingredients later. Let's go through my highlights of this article. So previous authors had reviewed 84 patients with the onset of neurologic disorders within 30 days. Here they noticed that 1 to 25 days after vaccination in 59 patients, and of these, 45 patients had an onset between 6 and 15 days. So what that means is that 14 of these patients had onset after 15 days, but prior to 25 days. So that's roughly 25% of these patients. Now, why then would these authors unjustifiably limit the scope of their conversation to within 15 days of vaccine administration when their own review of the literature shows that adverse vaccine events can occur up to 30 days later? So they've just stated here up to 30 days later, up to 25 days later, and then they say, okay, well, we're going to close that window even smaller and only look at cases that occurred within 15 days of vaccine administration. That makes no sense whatsoever, even looking at their own background research. So this is bias. This is structural bias within the article. 15 days or less. And again, let's look at some other highlights over here. So biological plausibility, I'll talk about that more in this quick review. Biological plausibility that measles vaccine might cause encephalopathy. To understand this biological plausibility, you need to understand a few things about neuropathology, for example, and I'm going to tell you the two words that you need to know. You need to understand biological plausibility that a measles vaccine could cause encephalopathy. To understand that, you need to know two words, and I'm going to tell you what those two words are later in this presentation. So hopefully you'll pay attention. You've got to get at least those two words. Now, those two words that I'm going to give you are not the only two words that you would need to know if you really wanted to understand this to a high level of detail. But to understand this, you need to have two magic words at your disposal. They also filtered the information even more. So the information that they were willing to consider for this review was based only on medical records, some of which was reviewed by so-called medical expert. Now, you'll notice that they don't define what a medical expert is. They just kind of self-appointed that title to whoever they wanted, basically, which I think is just bias. I mean, uh, those words should have some level of importance and significance, but for them to just state that they appointed an expert, that's a meaningless statement. Again, they're only looking at cases here that occurred within 15 days of vaccination. Children selected for this study had an acute encephalopathic illness followed by chronic encephalopathy, including mental retardation, seizure disorders, movement disorders, motor or sensory disorders, again, including deafness and blindness. Seizures with mental dysfunction attributed to the postictal state or medication were not considered to be encephalopathy. That's further unnecessary exclusion of the cases that they were willing to consider for the publication of this article because, for example, let's say that a young child gets vaccinated and has severe seizure disorder, and because of that severe seizure disorder goes on to develop mental retardation. That certainly occurs, and those cases were excluded from this research review. So again, my concern is that they inappropriately excluded a lot of patients who should have been included in this conversation. So nonetheless, they limited the field down to 48 cases. 25 males and 23 females met inclusion criteria and acquired an acute encephalopathy of undetermined cause 2 to 15 days after receiving the measles vaccine, MR or MMR. This acute encephalopathy was followed by permanent brain impairment or death. And we'll look at the table that they put here. So of the cases that they reported, you'll notice that most of the cases clustered here with regard to the onset of neurologic illness following vaccination. So basically what this graph tells you is that if this brain injury were caused by some other random event or another illness in the environment, what you would expect is that the onset or the date of vaccination should have no relevance whatsoever. So the fact that the date of vaccination is relevant to the onset of illness tells you that the illness is subsequent to whatever occurred here, which of course is the measles vaccination. Let's go back to the top of the page and on to the next page. 48 cases of encephalopathy occurred between 2 and 15 days. Again, you can see that here. Let's look at some of the examples of conditions that occurred. Ataxia, behavior change in 8 seizures. The onset of neurologic findings varied in severity from ataxia, which means lack of coordination, inability to walk, or behavior changes, to prolonged seizures or coma. Fever preceded the onset of acute encephalopathy by several hours to several days in 43 of the 48 children. Again, ataxia, mental retardation, seizure disorder, chronic ataxia, and sensorial hearing loss. Here's a case report of a normal 16-month-old female who received the MMR vaccine. 9 days later, she developed fever, measles-like rash, and ataxia. So 8.5 years later, at age 10 years, she has global developmental delay and cerebellar dysfunction, which means, again, ataxia or lack of coordination. The 8 children with initial behavior changes rapidly progressed to coma. 2 died during the acute illness, with autopsy findings of massive cerebral edema and herniation. Of the 6 survivors, 6 had mental retardation, 5 had spastic paresis, which is kind of like cerebral palsy, 1 had seizure disorder, 1 had choreathetosis, which is a movement disorder, and 1 died 6 years after the acute illness. Well, quite interesting that they would limit this conversation to only those patients affected within 15 days when they know the consequences can occur up to 6 years later. A case example of this group is a normal 29-month-old male who received MMR and Hib and 14 days later developed fever, emesis, and progressive lethargy. Well, I suppose that we're fortunate, ironically, that his illness occurred on day 14 because if it had occurred on day 16, he would not have been included in this study. So he was approximately 2.5 years old when this occurred, and at age 5 years, he has hyperactivity and aggressive behavior. Let's look at one more case here. A case example from this group is a normal 16-month-old female who received measles vaccine, and 7 days later she developed fever and measles-like rash. At age 10 years, she continues to have spastic left hemiparesis, which basically means she's paralyzed on half of her body, and she has cognitive difficulties. That's easy to say, cognitive difficulties, but that could include inability to go to school, inability to have a job, inability to live independently. Let's see what other comments I may have made. The distribution was non-random with clustering and 2 statistically significant increases of 8 and 9 cases on post-vaccination days 8 and 9 respectively. This finding is evidence for causal relationship between further attenuated measles vaccine and permanent brain impairment or death. And now let's look at the comments that they make in the discussion. They state, quote, "It is biologically plausible that encephalopathy with variable outcomes could occur after measles vaccine administered to these children." Moving on now toward the end of the article, you can see that they're going to work very hard to arrive at their desired conclusion. The 48 cases of encephalopathy probably represent underreporting to this passive system, which does not require individuals to file for compensation and requires medical documentation. So that's probably the understatement of the year. Of course, these cases are underreported. In fact, we know now that at the most, 10% of cases are reported, and probably closer to 1% of cases are reported. Now, let's apply that information to their conclusion. You'll notice that they found only 48 cases. Well, if we state that this only represents 10% of actual cases, then what this really means is that there should have been 480 cases, not 48 cases. If this number represents the 1%, which is probably more accurate, then this number would have been 4,800 cases of encephalopathy. So at least it should be 480 and probably closer to 5,000 cases. The authors state, given the generous compensation offered in this program, that's a horrible misstatement, that's a lie, and that's an insult to the families who have had to go through this program.
Senator Millett, Representative Cornfield, members of the Committee on Education and Cultural Affairs, my name is Robert Foley and I represent the citizens of Senate District 34, which includes the towns of Kennebunk, Wells, North Berwick, Lebanon, Acton, and part of Berwick. I'm here today to oppose LD 798 and any other bills related to changes to the current laws regarding philosophical, religious, or personal exemptions for parents choosing to not immunize their children or to immunize them under a different protocol. My wife and I were parents of a 2-month-old daughter who died 32 years ago, just 36 hours after receiving her first set of vaccinations, including the DPT shot. There's not a person in this room or in these halls who will ever convince us that those shots did not play a significant and vital role in our daughter's untimely and unwarranted death. Our daughter was a healthy, vibrant baby weighing 7 pounds 11 ounces at birth, receiving an APGAR score of 9 and exceeding all growth markers for her birth until her death. Her doctor the day before she died remarked how well she was doing in comparison to the standardized growth charts where she registered above the 90 percentile. After her death, her doctor secured the remaining quantities of vaccine serum he had for the possibility of testing the vaccine serum for potential imperfections. Inquiries to the State Medical Examiner's Office, the Maine CDC, and Federal CDC regarding the testing of the serum were rebuffed as unnecessary and potentially problematic for the vaccination regimen being implemented throughout the country. We were told on several occasions that no good would come of our pursuing the testing we were requesting. It was time for us to move on. We were left with the status of diagnosis, no known cause of death, sudden infant death syndrome. My wife and I were not informed of by the state of the federal CDC that the Vaccination Injury Court even existed for our appeal of the testing of our daughter's vaccine. And let me be clear, we went after vengeance. We were after truth. If vaccines are so safe, why has the federal government exempted all manufacturers of any liability, and why has the vaccine court paid out over $4 billion in damages? Fortunately, my wife and I had 2 other children after our daughter's death, both similarly healthy, with similar growth progressions, but neither of them had vaccinations so early in their lives, and neither had the DPT shot, just the DT. We did not start vaccinations until after 6 months, and never multiple injections at any one time. As a result, my wife and I used the philosophical exemption requiring our children to be vaccinated under different protocols. We're very diligent parents. Our doctors understood our concerns and respected our philosophical feelings and beliefs. We never put our children or anyone's children in danger by exercising our rights as parents. Every school they attended from pre-K all the way to college equally respected those rights. This bill will prevent many students from attending Maine schools. Many foreign students from Europe, Japan, Asia, the Middle East, and beyond are not currently exposed to the same vaccination regimen required by this law. In fact, many countries do not even require vaccinations. Many immigrants coming into our country have no vaccination histories, and yet we let them into our schools without the same questions. I do not wish a child's death on any parent. That pain is with me today. I only ask that people have some compassion for the wrenching decisions that my wife and I had to make as a result of our daughter's untimely death. They were not easy decisions and were not made without a great deal of contemplation, consultation with our medical providers. Unless you believe that healthy babies simply die for no reason, I ask that you respect and understand the difficult decisions that parents who have had a tragic vaccination reaction like ours have faced.
Again, the authors lie in this statement. Given the generous compensation offered in this program, it is reasonable to conclude that most serious cases temporally related to vaccination have been captured. That is a lie. They know it's a lie. At best, it's 10%, and it's probably closer to 1%. So, based on their bad data, failure to investigate, failure to accurately report the effectiveness of this data capture system, which, as they already admit, is passive and voluntary, they conclude that the incidence of this problem is very low, and that conclusion is unsubstantiated and inappropriate. Now let's look briefly at the actual ingredients of the MMR vaccines. You can see 3 varieties available here, all of which contain potential antigen sources, such as chick embryo cell culture, aborted human cells, so this is the WI38 human diploid lung fibroblasts. WI38 is a diploid human cell strain composed of fibroblasts derived from lung tissue of a 3-month gestation aborted female fetus. This vaccine contains the same aborted cell line as does this one. So all 3 of these MMR vaccines are derived, at least in part, from so-called media that involve the use of aborted human fetal cells. You can see that these 2 vaccines, so all vaccines contain the WI38 human diploid lung fibroblast cell line, again derived from an aborted fetus. And these 2 vaccines contain an additional aborted human cell line called MRC5. MRC5 stands for Medical Research Council Cell Strain Number 5. This is a diploid human cell culture line composed of fibroblasts from lung tissue of a 14-week-old aborted Caucasian male fetus. You also see other derivative media and substances such as hydrolyzed gelatin, presumably from cows or pigs, human albumin. Neomycin is a highly allergenic antibiotic, bovine calf serum. So let's just go through how many animals do we have represented in these vaccines. So chicken, cows, human, and cows again. So here we have chicken, human, cow, human, and cow again. And one more time here, chicken, human, cow, and cow. Again, along with a highly allergenic antibiotic. So in conclusion, the biological plausibility here is supremely well established, but this was established after the vaccination paradigm and after such policies have been codified. What I told you earlier is that to understand the biological plausibility of vaccine-induced brain inflammation, you need to understand 2 words. And I'm going to tell you right now what those 2 words are. The 2 words that you have to understand are glial activation. You could also state microglial activation, but if you state glial activation, that's a bit more inclusive. What glial activation signifies is the activation or stimulation of immune cells within the brain called microglia or microglia. Those are the immune cells of the brain. When those become activated, they stimulate another group of cells called astrocytes to produce more glutamate, and glutamate is an excitatory neurotransmitter. When neurons are exposed to too much glutamate, they get overexcited, and that's what causes seizures induced by, let's say, immune challenges to the brain. So if the brain receives a traumatic or chemical or toxic or microbial insult that's going to stimulate or activate the microglia or microglia, that activates the astrocytes. The astrocytes produce more glutamate. The glutamate stimulates the neurons excessively, and that leads to seizures and neuronal death. And that's exactly what you see following traumatic or toxic insult to these microglia or microglia. I think that the appropriate conclusions of this article, again, is that biological clinical causality of MMR vaccination and brain damage is established. The frequency of this complication is not known because of inadequacies in research and also post-marketing surveillance. We should have obligatory reporting of cases and appropriate investigation without political and financial bias, which is wholly impossible in the United States due to political funding loopholes and laws that allow drug companies to bribe politicians. These adverse effects, when they occur, are absolutely devastating to the patient, who is either dead or brain injured, the mothers, the fathers, the siblings, the extended families, the caretakers, employers, healthcare providers, and society as a whole. None of those people were mentioned in this article except for the few patients that they were able to include based on their very narrow inclusion criteria. So again, where was any conversation regarding patients in terms of their suffering, not simply their illness, but their actual suffering? Mothers, fathers, siblings, extended families, caretakers, employers, healthcare providers, and society as a whole. No patient or family should have to accept this risk per government mandate, especially when the politics are stronger than the science, and politicians have been paid to enact these laws at the favor of profiteering drug companies. Practical actions that we might take away from this article. Patients obviously have personal human rights to avoid this intervention regardless of the profiteering laws enacted by bribed politicians. You don't need a law to tell you what your human rights are. That's why they're called human rights. Modern clinical trials need to be performed among various groups. Those could include vaccinated, unvaccinated with a legitimate saline control, not injections that contain toxic ingredients, and a third group, unvaccinated with a saline control and antiviral nutrition. That's the direction that these clinical trials should be taking. That is, to have a vaccinated group, an unvaccinated group with a saline control, and a third group, unvaccinated but with antiviral nutrition. We should not continue to ignore the mountain of research showing that nutrients have antiviral effects for the prevention of viral illnesses and for the treatment of viral illnesses. And finally, here on the last page, I'm going to review a few facts of life. Despite the hype and legitimate difficulty of medical school, doctors receive no training in critical thinking, doctors receive no training in research analysis, and I can state that because not only did I go to medical school, but while I was in medical school, I also did a pre-doctoral research fellowship with the NIH, and the training that we received in that program was still pathetic with regard to research analysis. Many medical school faculty, often by obligation to keep their jobs, receive funding and grants from drug companies, therefore aligning them with drug company motives while also filtering out those who want to conduct legitimate independent research, otherwise known as independent thinking. So another way of stating that is, all of the professors that one is likely to encounter in medical school have also been bought or have bought themselves into the medical paradigm. You're not going to find a lot of independent thinkers among medical school faculty, and you're certainly not going to find people who have gone above and beyond, we might say, the medical paradigm. Most or many medical textbooks are authored by experts who are paid by drug companies. Medical journals and authors that publish treatment guidelines are essentially always paid directly or indirectly by drug companies. In order to remain in medical school and receive the required training and hospital residency, all medical students and residents must submit to vaccine mandates, despite little or zero supporting data or despite data proven to be falsified or exaggerated. Number 7, medical students receive zero training in vaccines, let alone in assessing and understanding adverse vaccine reactions. This creates a huge blind spot, a systematic and institutionalized blind spot that gets filled with ego, bravado, profit motive, and forced conformity. Point number 8, concluding, Mothers of vaccine-injured children and other lay people who investigate vaccines quite possibly or quite probably have read more information about vaccines than many, quote, board-certified physicians, unquote, the latter of whom have had to submit to vaccinology from a young age while being hazed, intimidated, and sleep-deprived. If you'd like to download this video, you're certainly welcome to do so. You can find it on various channels. You can also find me on Facebook, Minds.com, Vimeo, Patreon, and also PayPal. Thank you very much for your interest and attention.
Migraine causes headache and other neurologic problems. Scientists and doctors are always looking for new drugs to sell to alleviate this problem. But did you know that migraine is not caused by a drug deficiency? When cells cannot produce energy and control inflammation, migraine is a common result. Alleviate the pain and free yourself from the burden of daily and monthly and yearly drugs. You can learn to improve your cellular metabolism to alleviate the dysfunction that leads to nerve inflammation and migraine. For cheaper than a corporate coffee, you can have the entire treatment plan for migraines. Read it on your iPad, phone, computer. Target the cause of the problem: dysfunctional mitochondria that promote nerve and brain inflammation. The ebook is cheaper than a corporate mocha. Download Migraine and Headache Revolution from Amazon on the free Kindle platform. Become your own solution with Migraine and Headache Revolution. Look for Dr. Vasquez's books on migraine and inflammation on Amazon.com.
Let's look at another article here from an experimental study published in Journal of Neuroinflammation 2012, Etiology of Autistic Features, the Persisting Neurotoxic Effects of Propionic Acid. What's noted specifically in this abstract is that propionic acid is neurotoxic and that it leads to impaired energy metabolism. It also promotes inflammation as evidenced by elevated levels of interleukin-6, tumor necrosis factor alpha, interferon gamma, and heat shock protein 70. The authors note that this confirms a neuroinflammatory effect of propionic acid. Let's maintain this theme and take a look at another article here, Protective and Restorative Potency of Vitamin D on Persistent Biochemical Autistic Features Induced in Propionic Acid Intoxicated Rat Pups. What was shown here is that vitamin D supplementation could mitigate and basically neutralize some of the neurotoxic and adverse behavioral effects of propionic acid. The authors state in their conclusions that vitamin D showed a protective and therapeutic effect on propionic acid-induced neurotoxicity, along with, quote, a remarkable amelioration of the impaired biochemically measured parameters representing neurochemical, inflammatory, and detoxification processes. So, as I stated previously, vitamin D definitely plays a role in the treatment of various types of dysbiosis-induced neuroinflammation. Along these same lines, some of you may have seen the recent article in Humans showing that vitamin D helps to preserve and protect mitochondrial number and performance in human patients treated with statin drugs. So again, we are continuing and extending the vitamin D paradigm shift, which started more than 10 years ago, showing that vitamin D has manifold benefits, not simply for the absorption of calcium and the maintenance of bones, but also numerous metabolic effects, including anti-inflammatory effects, neuroprotective effects, now very clear evidence that vitamin D helps to protect and promote mitochondrial function. Another article here, published in Lipids in Health and Disease 2014, Relative Abundance of Short-Chain and Polyunsaturated Fatty Acids in Propionic Acid-Induced Autistic Features in Rat Pups as Potential Markers of Autism.